This is Going Under, Anesthesia Answered with Dr. Brian Schmutzler. I'm Vahid Sadrzadeh, and we're brought to you, as always, by our good friends at Butterfly Network.
All right, I'm going to let you in on something that's completely changed the way that I practice. I've been using Butterfly probes for years. It's a portable ultrasound that plugs right into my portable device, like my compatible smartphone or tablet, so I can start scanning at the bedside in seconds. If you've used the older versions, or even if you're new to the handheld ultrasound game, let me tell you why this new IQ3 is a game changer and really impressive. First off, having an ultrasound that literally fits in my pocket means I can move faster, whether it's vascular access, procedural guidance, or just getting real-time insights from my patients. And the tech inside this tiny device is pretty incredible. Biplane imaging lets me see short and long axis simultaneously, huge for procedural guidance, and honestly a great tool for learners. The new needle out-of-plane preset even lets me scan the plane digitally so I can see the needle tip sooner, which is critical and makes a real difference when precision matters. And the image quality, honestly, the IQ3 holds up against some of the high-end cart-based systems I've used. That's impressive for something this portable. If you're looking for a device that supports your practice, I can't recommend the Butterfly IQ3 enough. And right now, they're running a special deal.
I was still wondering if they're doing that.
They are. You can get $750 off the latest IQ3. Check it out at butterflynetwork.com.
Thank you to them. As always, we took a mental health week. Everybody does that.
We did. It's been very busy.
This is an interesting topic that we're covering today.
It is.
Because obviously you've grown your brand on social media over the last couple of years. And
5 years organically. Thank you.
Yep. Every one of those are real followers.
Yes, no followers purchased. I'm looking at you.
As somebody who is
involved,
more or less involved in your social media, I can guarantee you those are real followers that we did not pay for.
Yep.
So thank you for subscribing to all of the channels and to watching and to listening. But the biggest thing here in the takeaway, we'll talk about it as we go along, because some medical student did some nefarious things on social media,
maybe,
quote unquote.
Yeah.
And we're going to talk about that. But overarching is doctors, physicians have overtaken social media.
Yep.
We saw that post-COVID. There was a need for it. There was a want for it.
Right. And I think that I've heard this time and time again, even from some medical influencers that I don't particularly like, is that medical professionals became influencers because influencers tried to become medical professionals.
I got to wrap my brain around that. But yes.
So the influencers who had no medical background
tried to become
medical professionals on TikTok, on social media. And
so that's why it spurred on physicians, doctors, CRNAs, nurses, whoever, to do more TikToks.
Yes.
At what point, and you have gotten asked this question before, at what point, maybe not nicely, but at what point does it cross the line of medical information, entertainment, right, and professionalism? And I think that's what we're going to dive into today.
So the biggest thing for me is keeping like PHI out of it, unless the patient specifically signs a consent that says that you patient health information. Yeah. So unless the patient signs a consent that says, hey, you can use X, Y, or Z on social media platforms, that's probably number one, right? That's the low hanging fruit. Don't break HIPAA. We learn all this. I think the next thing is being accurate. So if you're completely inaccurate, lying about things, that's probably a big issue. And then I think the next thing, and so some of us have a little bit more leeway in this than others because, I own my own business and I'm not in medical school or residency. Like I don't have all those constraints. So I got a little bit more leeway to be a little bit more edgy. Not that I'm super edgy, but edgy. But you got to think about, who your employer is and what they're going to think about.
Because the brand is you.
Right.
The brand isn't somebody else's brand.
Right.
That's a fine line to cross.
It is.
And I'll share from a perspective of social media agent.
Yeah.
Basically, there is a fine line when doing anything. Let's say you're a dancer. Let's say you're whatever, right? You're still representing the company or other people.
But you're not.
No, you're not. However, when you put it out there publicly, and I've seen this with my industry and other industries, you've had a little more leeway in that regard.
Yeah.
However, when it comes to the content, it's interesting what flies, what gains traction, and what doesn't.
Yeah.
Because we've seen over the years, we can get on here, you can get on here, and we follow news, we follow trends, stuff like that. but it's the things that you least expect that will hit the trend.
Yep.
You'll get 10 million views for walking down a hallway and not saying
putting a jacket on,
not saying a word.
Right.
But if you go on there and say, hey, like, I'm going to respond to this cancer treatment that we've been seeing that's been working, you'll get maybe a couple thousand views.
Right.
Real views, by the way.
Yes.
But it's interesting because that's where it toes the line.
Mm-hmm.
It toes the line between knowledge and information and then entertainment.
Yep.
That's where it toes the line.
Yeah. The problem is that you have to either get on those trends naturally, or you have to be a little bit salacious to get on those trends, or you have to have something like, I don't know, there's one of those medical influencers out there who's like always hitting the phone, which drives me nuts, but that's her thing, right? So that got her popular. Everybody kind of has their shtick,
right?
And so sometimes that's being a little bit salacious. Where does that cross the line? It's hard to tell. So again, I think there are like some cut and dried things like patient information and
100%
and absolute untruths. But after that, it's like, it's kind of a balance. Like we're
well, you saw those people in the OR that got in trouble, that physician a long time ago that got in trouble for the OR. We don't do things like that.
No, absolutely not.
And if we do things in a setting like that, it's off hours.
Right.
No patients are involved.
Right.
Nothing was compromised.
Right.
Let's talk about this in particular.
Yeah, so this one's a little bit interesting. So this is the viral medical student controversy. So I'm not going to name names, but he was a medical student at supposedly Mayo Clinic College of Medicine.
And so Minnesota?
It doesn't say.
There's like different Mayo
clinics. So there's a Mayo in Jacksonville. There's a Mayo in Arizona. Anyway, so he put up a bunch of videos. The way I take them is satirical. I mean, he went a little too far, I guess, in my opinion, but they seem satirical. So anyway, they're criticized as misogynistic, mocking patients, including women's health topics, unprofessional clinical behavior. Again, just kind of like crossing that line. Now, again, if I'd have done, I wouldn't, because that's not who I am. But if I'd have done this, I mean, I might have gotten a little bit of pushback, but probably not fired. But he's a medical
So he got
student.
fired.
Well, that's what it says. There's no official confirmation from Mayo Clinic he was fired, but he was reportedly, removed from.
He deleted his social media account.
Yeah. So, you've got to be much more careful when you're in training. And we made this point before when we were talking about the resident who is posing herself as an expert, right? Like when you're in training, you got to be careful that you're not overinflating what you know, but also careful that you're not out there doing something that your program's going to be unhappy about. Because here's the problem with him. If he's a fourth-year medical student and he gets kicked out of medical school, he's going to have a hard time getting into another medical school.
Right.
And then what's he going to do with his life? For me, let's say, for instance, I did something like this and I was fired from a job. I can go find another job. I'm still a board-certified anesthesiologist, right? I'm going to have to explain why I got fired, but I mean, there's still opportunity there. When you're a medical student and potentially a resident as well, although, you're a physician when you're a resident, so maybe it's less troublesome. But yeah, as a medical student, if he's kicked out, he's not getting into another medical school now.
So I know you've gotten approached probably from dozens of medical students because those are kind of who tune into these podcast / information reels and sessions and stuff like that. But they've approached you asking, hey, like, have they approached you asking what are the steps? How do I become an influencer? How do I start that on social media? We've talked to a few who have built it the right way, have built it, on the straight and narrow.
Yep.
But what was your advice to those people?
Unless you have an inordinate amount of time, which most physicians don't, even medical students or residents don't, you hire a good team, right? So everything I do is my own, but I've got a good team around me who follows the trends, make sure that we're recording things, make sure that we're posting appropriately, answers questions to people, lets me know if somebody, sends in a really good message that I need to respond to directly. So you've got to hire a good team if you really want to build it well. And then get a shtick, right? So my shtick is the self-deprecating anesthesiologist, and we do that with Dr. Adam Cien, and so it kind of all fits together, but kind of staying in character. Those would be the two things that I would say. Be prepared to dedicate a lot of time to it. It takes a lot more time than you think to really build a full-on social media presence.
And sometimes that means as a social media team saying no, right?
True.
Because I think teams,
influencers want to step over that line
And it's the job of the team that you hired to say, you know what? Yeah, that's going to garner you a lot of likes. That's going to garner you a lot of attention.
Yeah.
Is that necessarily the right thing to do? Is it on brand? Mm-hmm. And that's where I would challenge some media teams to not push that boundary.
Right.
Know your clients, know the area where you are, and whether or not that's the right move.
Yeah. And we've said no to certain companies who have approached us to be,
100%.
On collaborators or on with their team, just because they didn't fall in line with our values and didn't fall in line with our brand. So, although I am excited about what the next one that's coming.
Do I know this one? I don't know.
Yeah, we'll talk about it.
Okay,
it'll be a good one. So this whole thing though talks. This really brings up some topics of the collision of social media and medicine. We're going to be on social media. It's going to happen. Again, the reason that we got on social media is because social media people tried to become medical experts. So that's not going to stop. There's a big appetite for it. It's going to continue. I guess the question that you have to answer, and I think this is different for everyone. What's the definition of professionalism, right? And so all the societies have stayed away from this. All the medical societies, they don't have a stance on whether you can be on social media, what your social media can look like, what's professional and what's not. So it's a person by person and organization by organization thing. Also, the risk of performative medicine versus real medicine. So we do some of this when we're kind of showing things, or if we're like pretending something happened with a patient, we do some performative medicine. But we don't ever do it in a patient demeaning way. Mm-hmm. And that's what I think, even though it was satirical, that's what I think the problem is with some of the stuff that this particular fellow did. And then the trust contract between doctors and patients. So that goes back to not putting patient information online unless they sign off on it.
Have you ever had a conversation, or, I mean, obviously a lot of people out there who have conversations with their schools or teams or workplaces about social media. And, again, it could be an individual thing.
Yeah.
But I almost relate it to where workplaces are with AI.
Yeah.
A lot of workplaces don't have answers to AI yet because it's still developing. We've known about social media for a long time.
Right.
But I feel like the shift happened 6 years ago.
Yep.
Everybody's at home. Everybody's trying to make content. Yep. And all of a sudden you have this influx of people doing their own thing.
But you also had an influx of money, which drives a lot of the
social media
influencers too. So yeah. So the way I've heard it described to me, and I do work with a big national anesthesia company, is don't post something that you wouldn't put in the group chat to everybody at work.
Mm-hmm. I agree with that.
And I'm pretty comfortable that I don't do that. So
right. And I am surprised that some professionals, and this is outside the scope of medicine too, what they post.
Yeah.
Again, I'm not going to name names out there specifically related to the medical the medical industry, reels that I see. But there's some doctors out there. I'm like, what are you posting?
Yep.
Why?
Yep.
Why is this relative to what you do?
Right.
And I don't think it really, I don't think it boosts my idea of you as a professional.
The brand, yeah. I think staying away a little bit from things that you don't have any expertise in, it goes back to just like the resident saying she's an expert. Staying away from things you don't really have any expertise in, commenting about, I don't know, make it up. You're angry about the ant problem in Japan. Like, why are you commenting about that? It has nothing to do with you, especially if you put yourself up as a medical professional influencer. So, kind of staying on topic, I think makes a lot of sense. But, if you want to branch out, I've got no problem with it. I just don't know that it's helpful to your brand and helpful to medical TikTok or whatever, medical.
We've had plenty of clients that have gone the other way too. It's very safe. Like, I don't know if that's our brand. I don't know if that's who we want to, but as the audience gets younger and younger and younger, now the question is, okay, is social media the route to go? Is it better to be a silent professional? Is it better to go that route? I think there's always going to be an appetite now. As long as it's a 24-hour news cycle, there's always going to be an appetite for social media.
I don't think you can survive. If you are trying to gain clients, you cannot survive without social media. Because, yes, you may have a conversation with a client and they look at your website, but they're also looking at you on social media.
100%.
And advertising-wise, social media, you gain a lot of attention for less money, right? I mean, I'm learning very quickly how expensive TV commercials are versus radio versus
social media.
Social media, right? So I think that's key. But I think you can be tasteful, yet funny, and even somewhat salacious, and still be tasteful.
Well, if I look at you on social media and I say, hey, like, wow, that's a funny doc. He has a sense of humor.
Yeah.
Right? I always say trust, sense of humor, professionalism, whatever. But I want my doc to have a sense of humor.
Yeah.
I want my doc to be open and not, because I think the idea and why this is so big in this industry, the idea of a physician is the trusted, buttoned up,
right? Yeah,
we don't, not really extroverted, but into their own medicine, into studying, into something like that, and it's not really the extrovert. So I think people are shocked when they see, right, people who are physicians have a sense of humor or be outgoing,
or act. I mean, a lot. Let's be honest. A lot of what this
100%,
is acting, right? It's figuring out.
Not sure what you mean.
Yeah. I mean, am I really dancing around, putting coats on in the hallway? No. I mean, it's acting, right? It's acting to fulfill an idea, a theme that we're trying to put out. So you have to have a little bit of acting ability. And I'll be honest, go look at my first 4 or 5 reels versus now. You get better at it with practice too. But I agree. I mean, I've had several people come to me at hospitals I've been at, and I mean, people know me all over the state, all over the country, who talk about like, oh, you know Dr. Brian, he's on TikTok, he's on Instagram,
right?
And I always warn people when I meet them, like, I'm way funnier online than I am in real life. Like, I do have a serious side.
You're not a bummer in real life.
No, I'm not a bummer, but I'm also not doing dances with surgeons and running around the hallways.
But when it comes time for business, you do business.
Yeah, of course.
That's the professional line that we're talking about is, and I think that employers with this specific gentleman that was on social media, is you kind of lose a little bit of that credibility.
Yep.
And that's what employees are concerned about is not only their credibility as an institution, but
your credibility.
People are not going to come see you.
Right.
People are not going to come to the hospital because you're here.
Right.
Which is a sad place to be.
Yeah. And I think that maybe falls into people who actually have their own practice. So again, I'm a little bit buffered from that because I'm an anesthesiologist, and patients aren't like, oh, I'm going to that hospital because of that anesthesiologist. No, they're going to that hospital because of that surgeon. So, when people show up, they're not like, I came to this hospital because I want you to take care of me. They're saying, I came to this hospital because Dr. Cien's my surgeon. And, oh, you're the anesthesiologist. I've seen you on TikTok before. So, it really depends what area of medicine you go into. If you're a primary care physician, if you're a pediatrician, if you're a surgeon, people are coming to see you as an anesthesiologist.
And I think that should dictate to a certain extent what content you put out there,
true.
Right?
Absolutely.
You and Dr. Cien put out different content.
Right.
You may collaborate on some things because you're funny together.
Right.
But at the same time, you put out different content. And I think that's important. I can't go out and be somebody else that I'm not, Well,
and he's also trying to gain patients, right? So part of his social media is to show himself as a competent, excellent doctor, which I think he is, so that more patients see it, so more patients come see him. I don't have that incentive.
Right.
So.
It's an interesting, I guess there's more strategy to it than people think.
Of course, yeah.
I think people think, oh, I'm going to pick up my phone and just make content today.
Right.
First of all, it's not that simple.
It's not.
And it's not that easy, right? In terms of how to strategize what you want to become. Because trust me, I've seen way too many people and content creators think they're going to mold into this thing that they've seen. And at the end of the day, they go viral for something they didn't want to go viral for.
Right.
And that's a killer.
You also honestly have to do a lot of research, which I don't do. You guys do the research, right? So you have to do the research to know what the trends are and a little bit of prediction of what the trends are going to be. Because if you hit a trend too early, it doesn't hit, and if you hit a trend too late, you don't get any viewers for it. So it's just like any other industry.
It's a career.
It's a career, right? So yeah, I mean, have I gotten pretty good at doing what I need to do? Yes, but do I have the knowledge to do it? No, I have
here's a big question for you. Here's the $15 billion question.
Wow.
Would you do it again?
Of course.
Yeah.
Yeah.
I think it's very important, and you wanted to get into the social media realm for a different, sort of a different reason ultimately.
Yes.
But while doing that, we kind of fit into this other lane, and it's a combination of what patients want to see,
right,
what you want to put out there, and how you can kind of collaborate on some of those things. And I think it's a really interesting path.
Yeah.
But it's also a secondary path, right? It's like it's an offshoot of who you are.
Yeah. Well, and I can share some important knowledge kind of in funny ways. And then that's what we use the podcast for, is to really give deeper knowledge about anesthesia and medicine. I originally started out wanting to do regional anesthesia and teach, primarily anesthesia providers, how to do regional anesthesia remotely, because after COVID, it was so hard to travel. But that wasn't really hitting and wasn't super important to people. And so being the goofy, self-deprecating anesthesiologist seemed to work. And so that's where we are. Now I still get to, like I said, impart some knowledge here and there. And that's what the podcast does as well. But this is the lane I fell into, and here we are.
Yeah. And it's good. I mean, we still do news questions, so all of that kind of fits into the brand that you've created.
Right.
And I think it should be different for every person. Now, listen, if this dude got fired for doing something like that, you're going to need to relook at what you're doing.
Yeah.
And again, I think the important thing is, and you said it, if you're not going to say it in the group chat, if you're kind of so about it, don't put it out there.
Yeah. Well,
don't put it out there.
And you've got to know who your, not necessarily employer is, but you've got to know what setting you're in when you're doing social media stuff like that. So again, I don't know what area of medicine he's going to go into, but for me, patients don't come to see me. So even if I'm a little bit, close to the edge, they're not going to not come to hospital because of me, or whatever because of me. I own my own company. So there's not a lot of people above me to tell me I can or can't do something. And then, I also don't ever say or do anything that I wouldn't put in the group chat. So I think
I always think of my mom.
Yeah.
Sadie. If Sadie
could see
if
it,
Sadie's watching it, and she does, I'm not going to put it out there.
Right. Right.
Nobody needs to know that or see that, but we always know kind of what lane we should be in. And I think that's an important thing. I think that's it.
Yeah, I think that's really it.
That's it for today.
And really what I wanted to do here was just to put out there that this happened. I think there's still a lot that's not known. So I'm not condemning the guy. I'm also not condoning what he did, but I'm not condemning the guy yet without all the information. But just as a kind of cautionary warning, especially to medical students and residents who are still not done and don't have options, just be a little bit careful and try to be funny. That's the key. Try to be funny.
Try to be like Dr. Brian Schmutzler.
No, not necessarily like me. Everybody's got to get their own humor, right?
That's right. Well, this has been Going Under, Anesthesia Answered with Dr. Brian Schmutzler. I'm Vahid Sadrzadeh. We're brought to you by the Butterfly Network.
See you next time.